Hi, today I want to do a video about the diagnosis that is now known as functional neurological disorder. When I was diagnosed with it in 2017 in Norway, it was called dissociative motor disorder. Before that, it was called conversion disorder, and if we go really far back, it was called hysteria. For every name change, there is a nuance to it. So when I talk with other people, including psychiatrists, therapists, neurologists, other people in the healthcare system, I will say that I have a dissociative disorder. I also have other dissociative symptoms, not only the motor symptoms. So I will say a dissociative disorder and also say that I was diagnosed with it because of my poor motor control. And the reason why I do that is so that the person I'm talking to can be aware of the nuances there. If I was diagnosed with it when it was called dissociative motor disorder, that it later was changed into, for me, not the name of the diagnosis, but for me, it was changed into OSDD, so other specified or not non-specified dissociative disorder. So I am still using the dissociative motor disorder label because I was not diagnosed with functional neurological disorder, because there is a nuance there. There is a difference there. There is a difference in thinking about it, and there is a difference in how to assess for it and to give treatment for it. But it's still the same category, roughly. And we can see I am always forgetting to put this phone to silence this phone when I'm doing videos. I'm sorry for that. But it is still, no matter the name of the disorder, it's still roughly the same category. And so you will find that it's not completely new just because it's called functional neurological disorder. It's not like you go back and look at previous literature about it and you just go, oh no, oh my god, I can't find any kind of similarity. It's very, very similar, but for me, I say that I'm diagnosed with dissociative motor disorder, later changed to an OSDD, because that was what it was called when I was diagnosed. And that tells other people with expertise on this a bit about how the landscape was in society when I was diagnosed, how the thinking was in the fields of neurology, psychiatry, and psychology, and so on. But in this video, I will explain something about this diagnosis that it seems that very few people know about this. The patients and their family and friends don't know about this. And a lot of therapists and psychiatrists and even neurologists don't know this, even though they offer assessment and treatment to this group of patients. They don't know what I'm going to tell you. And if you go back into history and look at how the diagnosis has been explained, the symptoms of it, the treatment of it, if you look at it for every time it has changed name, if you go back and look at the history, you can start to see an image, a picture that gives you a different insight into this disorder than if you just look at the newest papers, the newest articles, and so on. Because labels and how we describe disorders and how we describe the treatment and how we do the treatment, even the actual techniques in treatment, they change also on the basis of how it affects the patient and the family and the society as large. Not affect them in the health way, but as in stigma, as in abuse, and so on. Because words matter. They sadly do. Words matter. So when it was called hysteria, back then hysteria didn't have the connotations that word has today. So if you say you're hysterical to a patient with functional neurological disorder, they will probably not even understand that you are talking about an actual diagnosis. They will probably think, dude, I am seeking help, I am seeking assessment, and you are labeling me as an hysterical person? No, so words do actually matter. But this has an effect on how we can access information about the disorder and about the treatment. Because of this change of words that is constantly happening in a society, we change words by the day, and people who are on social media, they know this. We change words and expressions by the day. So something that was written 50 years ago can look like, to an untrained person, it can look like something that is just horrible, because we are thinking with our 2026 brain. And if we are thinking with our 2026 brain and we are reading a text from 1926 or 1826 or even just 26, we will see that text as complete nuts, because hysteria is, am I really hysterical just because I need help? What? So we have to manage to understand that not only is the diagnosis changing label, but also the description of the diagnosis is changing to avoid this problem with patients and family and friends and society at large rejecting the diagnosis. We also have to change how the diagnosis is described, how the symptoms are described, and how the treatment is not only described but also done. And in this, if we are not able to understand that, we need or will go back and look at the literature, because there is a vast majority that was, what's it called in English? It's a vast amount of literature on this, actually, but we don't find it because we don't understand the language. So today I will talk about something that is not much known about this disorder. Functional neurological disorder, dissociative motor disorder, conversion disorder, hysteria. That is the same diagnosis, people. But it has changed during the years for several reasons. And it also has changed enough that I, as a patient with this diagnosis, are using that detail when I talk to others about it, that I was diagnosed with it as dissociative motor disorder. But still, the treatment, the way I am being treated and I am treating myself, is that I am actually going back and looking at these old texts, the old literature, to find and see better the whole picture. So, I'm going to tell you now that all the symptoms you have with a functional neurological disorder, you always had them. You are just noticing them. And I will give an example on this, because that can be a bit difficult to understand. But I will give an example on this from my own life. I was diagnosed in 2017. And from 2017 onwards, I have very focused looked at my symptoms to get to know my body and to understand my body and to help myself. And it's difficult. It's very, very difficult, because what is happening, and this stems from my childhood, I'm not gonna go into that now, but my brain, my mind is not communicating properly with the body and itself and with me. So I who sit here and talk to you on this video, because of my dissociation, there is a lot of things going on in my body now that I should be able to notice, but that I am not noticing, because I'm dissociating from it. And all humans are dissociating at some level. It's normal to dissociate at a certain level. So we're not supposed to feel our kidneys unless there is something wrong with them. We are not supposed to feel every bacteria working in our stomach. We are not supposed to feel the lungs stretching in and out. We can notice that our chest and our bellies are moving, but we are not supposed to feel the lungs. We are supposed to feel something. I can feel it when I'm swallowing, and I can feel it when I close my eyes. I can feel when I'm doing this, so I can feel it on the inside of my nose that I'm doing this, but I can't feel my cells working. I can't feel the blood flow in all of my body. So a certain level of dissociation is normal for a human being, because if we noticed everything, we wouldn't do anything else. It would be so much information at all times that we would just go, oh my god, cell number 1 billion and blah 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 is doing this. Oh, it's so much information. So a certain level of dissociation from your own body is normal. But with the dissociative disorder, with the dissociative motor disorder, as I was diagnosed with, functional neurological disorder later, conversion disorder previously, and before that again it was hysteria. With this disorder, you are dissociating from a lot of things you should not dissociate from. So I am dissociating from, for example, I am tightening my muscles at all times in my body, and I don't notice it. And it has been before, long before I got the diagnosis formally, it was noticed by a lot of people. I went to physiotherapists, I went to doctors, general practitioners, I also was seeing neurologists, and what's it called? I've forgotten. The people who look at your muscles and joints, those physicians, and it was noticed by several people during many years that I did not have the ability to relax. There was something going on with me that I wasn't able to relax my muscles. And at the same time that I was like this, I also had a very bad grip. I had a very bad balance. So when I was diagnosed in 2017, was trying for several years, and it's 9 years ago now, and I have been trying for all those years to map out my symptoms. And before this summer, I felt that I had reached a level of insight into my own dissociation and into my own body that I was kind of, oh my God, I'm starting to feel actually better. And I have felt better too. But then something happened this summer when my health just had a lot of things happen to my health. It was very random collection of things happening, like I got an infection, I slipped on my floor and I fell and so on. And suddenly I had to again look at my body with new eyes and say that, oh, okay, I kind of have to start over. Not fully over, but I kind of have to do it again. So I have been this week, I have been struggling with some symptoms that I first was thinking was, no, this is just a dissociation. This is just my disorder. This is just a normal way of being. I'm just no problem. But then it got worse, and then I had to go to the neurology department. I had to call an ambulance, and I had to go through the emergency room system, and I ended up with a neurologist in the general hospital that looked at me and checked me and said that, nah, he suspected it was a migraine, and that a migraine together with my dissociation, because I have migraine diagnosed from before too, and my migraine together with dissociation probably just became this huge ball of my brain being, I don't know. So now I have this new symptom, and it's very scary for me. And because I don't know, they can never guarantee. A neurologist and the neurology department, when I was diagnosed, I was really properly diagnosed, people. I was so assessed. I was through a lot of different testing in different departments, in hospitals and in the neurology department. So I was through kind of everything before they diagnosed me with this disorder. But they can't promise me that, they couldn't promise that, okay, we are not finding anything, but it might be that there is something there and we're just not finding it. So they couldn't guarantee it. Sorry. And that is very scary, to have all these strange symptoms. And now this week that this new symptom has become worse and worse for me. And it's very scary to think about that it might actually be something that is wrong in my body, that is new, that is an actual disease, that is an actual illness, something I need to fix. And they just can't find anything. So I was at the general hospital, and a neurologist was testing me and said that he couldn't find anything. Everything looked fine. The suspected diseases were not fine. There was no indication that other suspected diseases was there. So the conclusion was, okay, this is probably migraine together with dissociation, making it just worse for you. So now I'm sitting here and having to kind of, oh my God, I have to get used to a new symptom. And here is the clue. Is it really a new symptom? Or is it something that I am just noticing now? Yes, that's exactly it. Because with this dissociative disorder. The conversion disorder, the hysteria, the functional neurological disorder. The thing is that my brain, to me, who is the conscious part of me who is here in the front, to me, what it looks like is a new symptom. So to me, it looks like the brain is just making up a new symptom. Or that because he said it's probably migraine, or that the brain is just having a new symptom. So it's not this, because with the dissociative disorder, it's kind of like this, okay, the brain is making up a symptom, and I mean something specific about that, and I'm going to talk about that. But it's also with migraine, there is also actually something happening in your brain. There is changes happening in your brain when you have a migraine attack. But what they have found when studying this, and what has been suggested about migraines, is that migraines are the brain having a constant error. So you have in your brain a constant error that will never go away, but you compensate, the brain compensates for itself, and in certain situations the brain just can't handle anymore, and it can't compensate anymore, and then you suddenly have this attack. But it's not an attack, it's the brain just saying, I can't compensate for this anymore. Okay, you just have to feel how it is in this brain at all times. And that is what is happening with dissociation, with dissociative motor disorder. The symptoms, the me here in the front, me the conscious part looking out here, the symptoms I register, they are not new. They were in my body all the time. Absolutely all the time. I have these symptoms that I am experiencing. But I managed to run an override on it. And that is the dissociation. That I don't notice it. So this new symptom of mine, that is dizziness, that I am dizzy. It comes and goes, so I'm not dizzy right now when I talk to you. But this dizziness is there all the time. If this is a dissociative symptom or a migraine symptom, it's there all the time. But I manage my brain, my mind, my unconscious part. I'm not so sure if I like this unconscious concept, but we can talk about that in another video. The unconscious parts of me are compensating, and I am also the conscious part of me, the me who is here in the front. I am also doing things to ignore it. I am trying to just put it in the back of my mind and not think about it. But it's here, but it's there all the time. So, if you have functional neurological disorder, or dissociative motor disorder, or conversion disorder, or hysteria, but I have no idea if people who was diagnosed with hysteria is still alive because they are very old. But if you have some of these other labels on this actually same, roughly the same disorder, cluster of symptoms, what you are experiencing when you think about it as a new symptom is actually something that was always there. Your brain is not making it up as a new symptom. It's just showing you a new part of yourself. So when I am dizzy, I am just getting an insight into how dizzy I always am. Because dizziness comes from different things. It comes from being tired, it comes from being confused, it comes from overwhelm, and so on and so on. It comes from actually having a bad balance, bad feet, bad floors. I have bad floors in my living room. So it was always there. And I just have to say it again, that maybe there is actually something new. Maybe I am actually developing something, a blood clot in my brain, we don't know that, but let us just say that this is a dissociative symptom or a migraine symptom. It was always there. It was absolutely always there. And the same with all the other symptoms I have struggled with and that I have mapped out since 2017. They were always there. And when I was at the neurology department and they checked me again now this week, it's 9 years since the last time I was there as an inpatient acutely. So it's 9 years ago. I'm very proud of that. I have stayed out of hospital for 9 years, but then I had to go this week. But okay, sometimes shit happens. And what they also found when they were testing me was that I am still struggling with this, that I am tightening my muscles without even noticing it. Because they had some problems, they were doing these testing, with the little hammer, and the neurology tests are quite heavy, and I'm going to do another video on that. But when they were testing, they had some problems with testing me, not because they had problems and not because my reflexes were actually missing, but they could feel, the doctor who was doing this, he could feel that I was tightening my muscles. And I was sitting there and I was like, no, I'm not. I'm not tightening my muscles, dude. I am sitting here relaxed and well. And he was like, I can feel it. You are tightening your muscles. So I also got this confirmation in that examination. Not only was it confirmed that they couldn't find anything new neurological, that I had to go into the hospital for a long time, but I also got confirmed that I still am struggling with dissociating from my muscles, and that the dissociation is actually worse than I was hoping for. Okay, where was I? Now I forgot where I was, what I was talking about. Yes, because, so, let's recap. Dissociative motor disorder, as I was diagnosed with, is roughly the same as functional neurological disorder, but there are some nuances there. And dissociative motor disorder and functional neurological disorder is also roughly the same as conversion disorder and roughly the same as the old hysteria diagnosis. And if we are to understand this diagnosis fully, we have to go back in time. But to do that, to read old literature on it, we also have to understand the words, to understand that we can actually read this text and not be offended by being called an hysteric. Not be offended by being called conversion disorder, So we have to go back to see the full overview over the disorder. And to do that, we have to kind of stay very, very calm. We have to say that, okay, this will be offensive and insulting to me when I read it, but I have to remember that this is written in a different time when the diagnosis actually was called that, and that it's not the same meanings in those words as it is today in 2026. And that the common theme of this disorder is not that your brain is making up new symptoms that was never there, But your brain is actually making you, the person conscious here in the front, not noticing that it was already there. You always had these symptoms. You always had problems with the muscles in your neck, as I have. When your head starts to tick like this, you always had that problem with the muscles in the neck. When you try to drink a cup of coffee and you drop the cup, you were always that weak in your hand. But you are compensating for it. Your brain, your mind, your unconscious part, partly your conscious part, is compensating for it. So it's not new symptoms. You in the front, the conscious part of you, you aren't making this up. You aren't lying to other people about your symptoms. And your brain is also not making up new symptoms. But your brain is showing you something that was always there. There's a crack in your dissociation. Normally, so we can again compare this to a person without dissociative motor disorder, without functional neurological disorder. A person without it will not feel their kidneys unless there is something wrong in their kidneys. If there's something wrong in their kidneys, suddenly their dissociation from the kidneys breaks down, because the kidneys need, the brain and the body and the kidneys need to get it through to the person here in the front, to the conscious part of you, that something is wrong and you need to seek healthcare. And then there is a breakdown in the dissociation. But that's for healthy people. For people with the disorder I have, when there is a breakdown in the dissociation, I feel something that was always there, or at least there for a long time. So for me, in my body, it's pain and problems all the time. This body here is not a healthy body. This body here is a constantly disabled, ill, injured, wrecked body. But I am doing an override on it. My brain, not me consciously, partly consciously, but mostly unconsciously, my brain is doing an override on it. But when I suddenly discover a new symptom that my brain is showing me, it was always there. Okay. So, this is something that is, what I'm going to tell you now, is something that I have found in the literature about conversion disorder. Not about dissociative motor disorder, not about functional neurological disorder, but about conversion disorder, and that was before it was named dissociative motor disorder. In the literature about conversion disorder, we find this treatment technique where it's assumed that the symptoms you experience are a symbolic expression of something going on in your environment. An example of this is that I had a period where, some years back, where I was so cold all the time. When I went to bed at night, I was so cold. I had double the duvet. I had a summer duvet, I had a winter duvet on top of it, and I had this heat packs, and I was so cold, and I used wool socks and everything. I was so cold, and it made no sense that I should be so cold under all these layers with warm stuff. And sometimes I just let the bedroom door be open and my heat pump was just pumping in heat to the bedroom, and still I was so cold. And then I often woke up in the middle of the night and I was sweating and I was kind of like panicking because I was so warm and I was overheating, and I was like so it was very clear that double duvets, heat packs, the heat pump pumping heat into my bedroom, that was too much, but still I was so cold when I went to bed. And then I started doing this symbolic assessment of my life. So I said that, okay, I am very cold. What is going on around me? What can this be a symbol of? And then I found that I was being treated very coldly by the people around me. I was being treated very coldly by my ex-boyfriend. I was treated very coldly by my ex-husband. I was treated very coldly by family and friends. They were stone cold, their hearts, no warmth in their hearts. So I was treated very coldly. And I found that by interpreting this coldness I felt in my body. So now, in retrospect, it looks so obvious. I just had a panic attack when I went to bed at night, and I could no longer focus on other things. I couldn't scroll on social media, I couldn't do videos, I couldn't clean my house, I couldn't do art. I just had to lay there still and try to sleep. And I panicked. Of course I panicked. Because I was abused. So now in retrospect, it all seems so logical. It all seems so... It was right there in front of me. I was panicking. And when you panic, you start to get cold in your limbs, and the blood flow is kind of protecting your inner organs. So I was just having a panic attack, but I didn't recognize it as a panic attack. What I recognized it as was that I was so incredibly cold. And if somebody touched me, they would also feel that, oh my God, you're so cold. Yeah, because my blood flow was just... And in retrospect, it's also so obvious that I was being mistreated, that I was being abused, and that my son was being abused. So of course I had good reason to panic. I was in a constant panic because I was an abuse victim. And now in retrospect it seems so obvious. But back then it wasn't obvious to me, because I was both dissociating from my body. I didn't have the proper language for it. And we can, of course, that's debatable, because I'm cold. That, you can say that is a synonym to I'm panicking. But at least in this Norwegian society, you are actually supposed to know that is called a panic attack. But I didn't. I just couldn't register it. To my brain, it did not register as a panic attack. So the emotion and the feelings in my body just didn't register as a panic attack. So if somebody asked, I would just say, no, I'm just so cold. Because I just could not pick it up that, oh, it's a panic attack. And I also dissociated from the abuse because I was so used to people behaving like that. And also these abusers, they were telling me, and other people who supported them, they were telling me constantly that no, this is not abuse, this is normal. But now in retrospect, I see that, yeah, I was panicking because I were abused. But back then, I had to do this symbolic interpretation of what I felt in my body. And that doesn't mean that what I felt in my body is just a symbol. But it meant that by talking about it as a symbol, I was able to see something in my environment that suddenly kind of clicked into place, that I'm scared. I'm having a panic attack because I am legitimately scared of these people. So it's not a symbol. The symptom I had, it's not a symbol. It doesn't go away because I managed to call it a panic attack. I still had panic attacks. I still have panic attacks. They are cold-hearted, cruel people. I still have panic attacks. But by talking about it in this symbolic way, I suddenly started to see something. I didn't see the full picture of why I was panicking, but I started to see something. Another example, this is going to be a bit long video, but this is kind of important, especially because there are therapists and psychiatrists out there who are treating patients for this and they don't know this. Another example was that I had a dark spot on one of my eyes, not on the eyes, but on what I saw. When I was opening my eyes, there was a black spot in the middle of my where I saw. And that was very, very scary and annoying because I was actually partly blind because of that black spot that was always there. And then I started doing the same thing because I was checking my eyes, just to make sure that I say that. I was checking my eyes. I did go to my eye doctor. I did go to my optician and to my eye doctor, and I got it checked. So I was so that I knew that they didn't find anything wrong with my eye. Because this is important. You have to check. You actually have to check. These are serious symptoms, so you have to check. But then I did the same symbolic interpretation from the time it was called conversion disorder. I was going through, what can a black spot mean in my field of sight? What can a black spot mean? And I was concluding that it meant there is something here I am blind to. I am just partly seeing reality. And then I could go, oh, I'm just partly seeing reality. Of course I'm partly blind. I'm just partly seeing reality. Okay, let me look more on reality. Let me think about this. And then it disappeared. But that doesn't mean that the symptom disappeared because I was solving the symbolism. No, it disappeared because I could actually take care of myself in a better way. So what I did with that I was so cold in the evenings was that I just trained myself to relax. So I found another way to do an override on the fear I was feeling because of these abuses around me. And relaxing my muscles, working on relaxing my muscles, telling myself that even though you are cold now, in the middle of the night you will wake up and be warm enough under this one duvet. You only need one heat pack. You can take the socks and throw off because you are cold now because you are in a panic attack. But the panic attack will pass, so you might as well just fall asleep. And after a while I actually managed to fall asleep even though I was cold. And when I woke up in the morning, I slept through the whole night, and when I woke up in the morning, I was just normally warm. It was just a good temperature. So I was training myself to do an override on it in a different, healthier way. Instead of doing an override on it by piling on with duvets and heat packs and a heat pump on full blow, and I was finding a better way to do it. But that also, of course, included that I also had to tell myself that these people are cold-hearted, but I can sleep in my own bed anyway. So I kind of had to tell myself that these two things are separate. I do not need those people to become non-abusive for me to sleep in my own bed. And this symbolic interpretation is not the thing you will meet now. And when I was in the healthcare system of Norway, at least, because this symbolic interpretation has its limits, of course. If you just say that you are cold because the people around you are cold, and then you change out the people around you, and you can see objectively that the people around you now are good people, but you're still cold because you're still panicking at night because you have PTSD. So there you see that this symbolic interpretation really has its limits. You can only use this symbolic interpretation as a treatment if you know that it's just to get the thinking and conversation starting. And if you know that the symptom was already there. If you understand that the symptom you're experiencing was already there, you're just starting to noticing it, and the reason for it was already there, you haven't yet discovered that reason. If you understand that, and that it's just a conversation starter, it's just a contemplation starter, the symbolic interpretation is only meant to get you working on interpreting your body and interpreting the environment around you. That's the only thing. So it won't quickly solve it. It's not like I was laying in my bed and just going, oh my god, it's a panic attack. And then the panic attack stops and never happened again. No. It just gave me the start to contemplate what I could do differently to help myself. So it's rare, and at least that's my experience in Norway, and has been since 2017. It's very rare to meet people who will call it conversion disorder. It's very rare to meet people who will call it hysteria, even rarer. And it's very rare to also meet healthcare personnel who will suggest to you this symbolic treatment, because it has these limits, and it has been misunderstood. It can be so easily misunderstood how this symbolic treatment interpretation shall be done. I think I met one psychiatrist who said conversion disorder to me. But she was fairly old. So when she said conversion disorder, it was partly scary to me, because it was like, oh my god, she's saying conversion disorder. She is not updated. But on the other side, it was very good that she said conversion disorder to me, because I was going, oh my God, conversion disorder, I have to read about conversion disorder. But it's rare. And I also met she was what's it called again in English? A trainee. she was becoming a psychiatrist. She was under specializing in psychiatry, and she said to me that once upon a time histrionic personality disorder was called hysteria, and then they had to change the label because people reacted to the name. And because she said that, I was also, oh my God, I have to read about hysteria. So I got these reminders, because I was very ill at the point and I had forgotten a lot of what I knew from before. But I got these reminders here and here, a drop here and a drop there, and I got these reminders that you need to go back in history and you need to trace this diagnosis back in history to find the bigger picture of it, to see how it used to be treated. Because once upon a time, that was considered good treatment, and it was considered good treatment for a reason, because it worked. So, now I will talk about, okay, we can recap again. This is a long video, so let us recap again. Dissociative motor disorder that I was diagnosed with in 2017 is now called functional neurological disorder. Before it was called conversion disorder, and before that again it was called hysteria. This is the same disorder roughly, because there are some differences, nuances and details. And this disorder is that you are dissociating more from your body. You are noticing less about what is in your body than a healthy person does. Everybody, every human being is dissociating from their body to a certain level, because if we didn't, we could not function. And then you have people like me who are seemingly functioning to a certain degree because we are dissociating on such a high level. So when you experience and other people see in you new symptoms, it's not new symptoms, it's just a little breakdown in your dissociation. So suddenly you are noticing something that was already there. When I was very cold at night, I was just noticing how much panic I was in. That was it. I was always in that panic. It just had other ways of manifesting itself in my body. But I was always in that panic. So now I want to talk about something I saw on Twitter, and it was a link to a magazine called Parapraxis, and it was a text about how a patient with a therapist, a patient had developed cancer, and while her cancer was developing in her body, her therapist was starting to interpret these symptoms of her as symptoms of her childhood trauma, or what happened to her in childhood. So when she became thinner and thinner, the therapist said, oh, this is because you're trying to get the attention from your father, because you never got the attention as a child. And for every symptom, the therapist, or almost every new symptom, the therapist found a new explanation. And the patient got iller and iller and iller and iller, and in the end she finally sought a different type of healthcare, and it turned out that she had cancer. And this way of analyzing a patient as someone with this type of disorder, this somatization that the body is showing symptoms of mental stress, that's malpractice. That's not how we do it. And I want to state that very, very, very clearly. That is not how we do it. You can only analyze symptoms like that if the symptoms is symptoms on problems that was already there. In the case of a patient becoming thinner rapidly, you cannot do this. But if you have a patient who has been very skinny for, let's say, 10 years, and then suddenly they start to feel how heavy their boots are, how difficult it is to stay awake, and so on. When they suddenly start to notice the implications of them being very skinny, that's when you can analyze it this way. That's when you can say that it's dissociation or somatization. Dissociation is under the somatization umbrella. That's when you can do this symbolic interpretation of things, because it was already there, but it's the first time the patient has noticed it. To go back to one of my examples, the black spot on my eye. What do you think that black spot was? It was probably a floater. It was probably, I have a lot of dark spots and floaters and, in my eyesight all the time. A lot of people do. Maybe everybody. I'm not going to say that for sure because I'm not, but I have to Google. But a lot of people have floaters. A lot of people have these dots in their eyes. But suddenly I noticed a black dot or a floater in front of me, in my eye. Suddenly I noticed it so very well. I became extremely focused on that one spot. So that's when you can look at it as this dissociative symptom, as this conversion. That's when you can say that mental symptoms are manifesting in the body because it was already there. So to say that I had a black spot in my eye, that if I looked over there, that I saw this black spot, to say that that was something I did as a 38, 39-year-old to get attention from my father, because I never had attention from my father, enough attention from my father as a child. No, you can't do that. You can say, because it's not a new, maybe I explained this a bit badly, but the spot is not new. I'm just noticing it. And when I'm noticing it, It means that I am focusing very on it. The dissociation has broken down. I am not able, because in everyday life I am dissociating from my floaters. I'm not caring about my floaters in everyday life and these black spots. Sometimes I'm a bit like, was that an insect or was it just a black spot in my eye? Yeah, okay, it was a black spot. Oh no, it was an insect. But most days I do not notice these floaters and these black spots in my eyes. But when I did, there was a breakdown in the dissociation in my eye here. I no longer dissociated from that black spot in my eye. And then I was focusing very on it. And then when I started doing this symbolic interpretation of it, that was when I started to get the thinking flowing, the thinking and talking. Okay, I have a spot in my eye, making me not see properly. There is something here making me partly blind. I am partly blind. Oh my God, I'm partly blind. I'm partly not seeing reality. Why am I not seeing reality? So it was just this conversation starter with my helpers and with myself. It didn't start. I didn't develop. I'm a bit afraid that I'm explaining it a bit badly now, but these black spots and floaters in my eyes did not start to occur because I wanted my father's attention in 2019, 2020, because I never had his attention properly in the 1980s. The floaters and the spots were always there. So with this patient who had cancer, who was becoming skinnier and skinnier, to say that that is something she is doing because she is wanting the attention from her father because she didn't get the attention from her father when she was a child. No. Then an eating disorder had to be present from childhood. If she was always skinny, very, very skinny, but she was going around feeling fine. She was going around and not feeling her boots as heavy. She wasn't struggling with energy during the day and so on. But suddenly she started to feel that being that skinny was actually taking a toll on her. That's when you can do that type of interpretation. That's when you can say that, okay, in your childhood, you were trying to get attention from your father. And you have been trying to get attention from your father your whole life. But now you are starting to notice that what you have been doing is actually having a very detrimental effect on you. You cannot do it the other way. You cannot say that if you were normal weight your whole adult life, and suddenly as a 35-year-old or a 55-year-old, you suddenly very abruptly lose a lot of weight. You can't then say that you are just doing this. This is just a manifestation of your mind. No. That's the opposite way. It is when something has always existed. If it has always been there, or at least been there for a long time. I was cold at night for a long time. I was panicking at night for a long time, but I didn't always feel it as being cold. I remember when I was married, and my son also lived here with me, I remember having these kind of cold attacks. I was just sitting in my sofa, watching TV or having a conversation with somebody or playing a card game or anything. And then suddenly I felt so extremely cold, and if other people touched me, they also said, "You're so cold." So it was always there. But it was when I started to noticing how much layers of duvets and how much heat packs I was using and how high temperature I had in my bedroom. And I woke in the middle of the night and I was like, I'm so warm. It was then I started to notice that this is a symptom of something. It has always been there. And if it didn't manifest as being cold at night, I had other types of panics at night. It was always there. It just registered to me as a new symptom. But it wasn't a new symptom. It was just a breakdown in the dissociation. A breakdown in the dissociation from my body. A breakdown in the dissociation from my environment. And by interpreting this in this old way as symbols, then I could start thinking about it. But when you do that to people, and I'm really shocked after reading that text I found a link to on Twitter, I am shocked. I'm angry. I'm really, really angry on behalf of that patient. And I'm angry on behalf of the therapy profession who has not been educated properly about this. I'm really angry about it. Yeah, it makes me really angry. And it makes me scared. Because that patient is not the only one who has experienced that. It's very common. I'm sorry to say it, but it's actually very common to be mistreated like that in therapy. And that therapist, when she told her patient that actual new symptoms, like really actual new symptoms. And let me explain this. When I called the ambulance this week and I said, I have a new symptom. And the neurology department, I also told the emergency room 1 and emergency room 2, and I told the neurology department that I had a new symptom. I contacted them because you are supposed to contact them if you have a new symptom. So 1, I contacted the general hospital. I contacted the ambulance, the emergency room level 2, and the neurology department. I got myself into the general hospital, not the psychiatric ward, the general hospital, because I was experiencing what to me looked like a new symptom. But that patient in that article I found a link to in the magazine Parapraxis, the patient there, she didn't get herself to a general hospital. She only talked with her therapist about the new symptom. So she was assuming that new symptoms, both the patient and the therapist was assuming that the new symptom was a new symptom of mental illness. But when I experienced a new symptom that I couldn't recognize, I got myself into the general hospital. I did not call a therapist. I did not ask to get to the psychiatric ward. And I'm not against no matter how much I write it online, that I'm angry with the psychiatry. I'm not against psychiatry, people. I'm not against therapy. If I need to go there, I will go there. And I have been there many times. I have myself called an ambulance and asked them to drive me to the psychiatric ward. And I have called an ambulance and asked me to drive me to the general hospital. So I'm not against it. But when I experience a new symptom from my body that I have not experienced before, or at least I can't remember having experienced it before, I get myself to the general hospital. Because it might be an actual disease, something, an injury, something happening in my body that needs treatment in a general hospital, not in a psychiatric hospital. But in that text, the patient was contacting her therapist. For every new symptom, both the patient and the therapist continued to assume that it was a new symptom of her mental disorder or her mind. Let's just say mind. And that's very bad. That's very, very bad. New symptoms means that it might not be the same thing you are already struggling with. So you need to get yourself to a general hospital, not a psychiatric hospital, not your therapist. You need to get yourself to the people who can actually examine your body, not your mind, your body. And when they don't find anything, then you can go to your therapist and say, there's a new symptom here, let us explore. But you can't do that before going to the general hospital, before going to a physician that can check you. So, this is a very long video, but I hope that it was a bit enlightening to people. And so let me recap again if I can remember what I've been saying. I was diagnosed with dissociative motor disorder in 2017 in Norway. That is today called functional neurological disorder. It used to be called conversion disorder, and before that it was called hysteria. There are some nuances to these different labels, and there are differences in the literature about these different labels. And to get the full picture, you have to go back, and to go back to read the literature about these previous diagnoses, you also have to not read them with your 2026 brain. If you read something from 1926, you actually have to think like a person in 1926 to do that. And in this disorder, that is roughly the same under these names, roughly the same, the clue, the thing happening to you in this disorder is that your problems in your body was already there. Your problems in the environment, not your problems, but the problematic things happening around you, were already there. But you are on a higher degree than the average healthy person. You are dissociating on a higher degree from what is happening to your body and to you in your environment. So when you experience and report to others, and others also start to see something new in you, it's not actually a new symptom. You, the conscious you, are not making it up. You are not lying. It's actually there. And your brain, your unconscious part of your mind and your brain, isn't either making it up but there is a breakdown in the dissociation. So your brain, your unconscious mind, is showing you, suddenly you are starting to notice, you're starting to see something that was already there, and that was already there in your environment. You can start to think about this by interpreting the symptoms symbolically. But the reason for why we left this type of treatment was that people misunderstood it. Therapists, psychiatrists misunderstood it. So if you do it by looking symbolically at what is happening to your body, that there is a reflection in your body, your symptoms of what is happening around you and what is happening to your mind, and then you have to be aware of that it's just a conversation starter, a conversation either with yourself or with a helper about it. It's just a conversation starter. To use that, it won't remove what you're experiencing. It will just get your mind working, it will just get you talking about it. So it's a start. And then you can find alternative ways to live your life. And if you experience an actual new symptom from your body that either was never there, or at least you and nobody around you can remember that it was there before. If it's the first time you experience something, you go to a general hospital, you go to a physician, your general practitioner. You seek assessment of your actual body. You do not go to a therapist or a psychiatrist with this problem. If it's your eyes, you go to an optician and you go to the eye doctor. If it's something that you suspect it's neurological, you see a neurologist. If it's your feet, you see a feetologist. I can't remember what it's called, but you go to the person who is actually specializing in the part of your body that you are experiencing symptoms in. You do not go to a therapist or a psychiatrist. But if the general hospital, as with the neurology department when they examined me, if they can't find anything, then you can go to the psychiatry. Then you can go to the therapist. And if you are a therapist or a psychiatrist, you must never assume that new symptoms are an expression of a mental illness or personality disorder or neurodivergency or whatever. New symptoms from the body is not your area of expertise. New symptoms from the patient's body is the area of expertise of the people specializing in the actual body, not the mind. The body, including the brain. If you as a therapist or a psychiatrist mix this up, you are doing something horrible to your patient. You will end up in not a good place if you do this. In Norway, we don't sue our therapists or psychiatrists. In other countries, they do, so you might end up sued. In Norway, you will be outed online, you will your boss will come and knock on your door, you will maybe Helsetilsynet will take your license from you, and so on. But there will be consequences if you mix this up. So you have to understand this better. Okay, let me stop there. This is a very long video, so I hope it was helpful to somebody. Okay, bye.